as I said before, trauma is subjective. So you can have, as I've been saying, 3 kids all in the same family, all in the same house fire, and they may experience that event very, very differently. And so as we now delve into the realm of talking about assessment and trauma assessment, we want to keep in mind that we all might be experiencing the same event, but respond to it in a very different way. So some guidelines around trauma assessment. You want to assess not just presenting problems, but you also want to assess for strengths. It's important to meet with children separately from their caregivers when you are in the trauma assessment phase, because if caregivers are in the room with their kids during the assessment, kids often will censor what they say. And we really don't want the assessment to be contaminated by that. So we want to, ensure that the child can talk about what they want to talk about without worrying about what they say, how the parents are going to react. Rapport building is really critical. You want to always begin with rapport building. And I might say something like, sharing this information is difficult, but can help me understand so that our work together can be more effective. So that's something I might say to a child when we're doing an assessment activity that might, lead to some upset feelings. You want to make sure that confidentiality is understood at the outset, so that if a child discloses a safety concern that you have to report, because you are obligated by law to report safety concerns to proper authorities, you want to make sure the child understands your duty to report safety concerns. You want to differentiate between clarification and correction. What do I mean by that? Well, when you are in the assessment phase, your role is to clarify. When you shift from assessment to treatment, your role shifts from clarification to correction. Let me give you an example. Let's say you're assessing a child who experienced sexual abuse, and the child says to you, as part of an activity that they're doing, an assessment activity they're doing, the child says, the sexual abuse was all my fault. Well, what you would want to say likely is, it wasn't your fault. But why would that be an unhelpful response, especially in the assessment phase? Because you're really not clarifying, you are correcting. A more appropriate response would be to first validate the child's feelings, but then clarify. So you might say something like, I've worked with lots of kids who've experienced sexual abuse, and many tell me they feel like it was their fault. Tell me more about your feelings. Tell me more about why you feel it was your fault. So you certainly can validate how the child feels. You can convey empathy for how they feel, but then you want to clarify by asking an open-ended exploratory question. Now, you're going to make note of that as part of your assessment, and be sure to add to your treatment plan how you're going to correct that cognitive distortion of self-blame. So you might want to add to your treatment plan child to shift from a perception of self-blame to acknowledging, to realizing that they are not to blame for the sexual abuse.